Barriers to Inclusion, Homelessness and Mental Health, Issues in Canadian Public Libraries. Invisible, unheard, unwelcome. For people experiencing homelessness and/or mental illness, these can be common feelings. The Canadian Library Association's position statement on diversity and inclusion states that this country's libraries recognize and affirm the dignity of the people they serve, regardless of factors such as physical or mental capabilities and income. Despite this, many libraries have adopted policies which limit access to some of our most disenfranchised citizens. This part of our presentation will address some of the barriers which might prevent people experiencing homelessness and/or those with mental illness from feeling that the public library is a welcoming and safe space. All library patrons have the right to know that they are seen, heard, and respected. As we identify barriers to access, we must first recognize that people experiencing homelessness are not a homogeneous group. In addition to the types of homelessness identified in our introduction, we acknowledge that homelessness affects people of all ages, including children, teens, and the elderly, and people of all ethnicities, genders, sexual orientation, and physical ability. Statistics show that 1 in 4 people experiencing homelessness are employed, so homelessness does not necessarily equate to joblessness. The overrepresentation of almost all psychiatric conditions in the homeless population is also a huge consideration. Part of our planning and programming processes must include identifying the demographics of our own library communities. Despite these differences, the American Library Association's Toolkit for Reducing Homelessness Through Library Engagement identifies a number of common barriers to equitable access for people experiencing homelessness. They are: library card or access policies requiring a permanent address. No address, no library card. Prohibitive fines, fees, or other penalties, or the perception that services incur fees. Staff who are not trained in service to people who are poor or homeless, or who are made uncomfortable by prejudices against people who are poor or homeless. Limited promotion of library services at the community centers and organizations that serve people experiencing homelessness. Limited access to the library building by either lack of transportation or service hours. And lack of programs or resources that address people's experiences or current situations. Individual library policies, specifically those surrounding appropriate behavior and personal hygiene, can also present significant barriers to people experiencing homelessness and mental health issues. This may be particularly true for those people who use the library less for information seeking than as a place of warmth and sanctuary. Unfortunately, it is not uncommon for people in these situations to be labeled problem patrons and to be sanctioned for not following rules. Many libraries, for example, have policies prohibiting sleeping in the library, washing or doing laundry in the bathrooms, bringing large amounts of personal belongings inside, soliciting or begging, and strong or offensive odors. Some argue that rules such as these serve to criminalize poverty and encourage libraries to examine their policies to ensure that they are in fact regulating behavior for all users and not engaging in poverty profiling or punishing people for disruptive behavior attributable to illnesses such as schizophrenia or autism spectrum disorders. Having to police these rules can also detract from the primary focus of the library, which is to provide information service. It must be acknowledged, however, that finding the right balance between necessary rules and discriminatory practices can be challenging. Libraries have a professional and ethical responsibility to meet the informational needs of patrons experiencing homelessness or mental health conditions, but they must also maintain a safe and welcoming space for all library users. Many librarians do not receive sufficient training to know whether a situation presents a legitimate safety threat and how to effectively and respectfully handle those situations which do and those which do not. Sanford Berman says that rules which target poverty and homelessness might be seen as an unmitigated tsunami of insensitivity, stereotyping, callousness and bourgeois arrogance. But he goes on to say that this is mitigated by innovative and inclusive practices adopted by a number of public libraries. In the next section of our presentation, we will discuss how libraries are interpreting policy and providing in-library and outreach services to empower and support patrons experiencing homelessness and mental health issues.